Spring Cross Regional Dialogue 2020, which is virtual. We were hoping to have it in Philippines after last year in Chile, but yes, the new normal is here with us. So we are happy we could even have it virtually. And this is one of the sessions we are having today. And in this session, we are going to have Professor Schmidt-Kallert and then Dr. Genet Alem. I think she will introduce herself, and then we introduce Prof too. But we are happy to inform you that after this workshop, we will be having a series called For Papers, and there will be a publication. And these are various partners from our partner universities and institutions that are represented and supporting us. And we want to inform everybody that this session will be recorded. And although yesterday we were able to do a live transmission, this one is being recorded, and we'll have everything on the YouTube channel of Alumniportal Deutschland. So if you miss the simultaneous session going on currently on Future of Planning Education, you can always have it after tomorrow's session. Each one of the sessions will be loaded on the YouTube channel, and we'll be happy to have your feedback as well as the evaluation forms too. So I'll hand over to Dr. Alem, and then please take over for now. After the session, as you want us to discuss or however you want the workshop, we are here for you. And please, the co-host, please allow people in so that the room can be full and we can start the session fully. Thank you. So Dr. Alem, please, over to you.
Thank you, Genevieve. Yeah. Welcome, everybody. Can I see the people somehow? Maybe you turn off first your
turn on the camera.
Please turn on your cameras. Let's show we are live here and represent.
Yeah, I'm trying to see. Hello, everybody. Hello, how are you doing?
Hello,
Hi, everyone.
Yeah,
good
fine.
Evening from.
Nice to see you all.
Agustin is also
Manila.
there. I didn't see your name, but nice to see you guys all. Anyways, I'm really glad to be here, to see you again, and to participate not only as spring staff, but as alumni.
Thank you.
Maybe I introduce you shortly how we structured with Einhard this session. Want to have a little bit short introduction first, and then we let everyone to say to update us. We know each other, most of you, but want to know few information, very short one from you, an update. I won't call it introduction, as we know, most of us. And then after that, we'll go to the presentation of Einhard Schmidt-Kallert, and then we reserve time for short question answer based on his presentation. And later on, after that, we want to come back to you to ask you to give, to ask you and to see your views, your experience also. For instance, any opportunity arising from COVID-19 crisis, a kind of joint brainstorming from different countries, different background. And at the end, before we conclude, we try to see some kind of scenarios, future scenarios, together with you. Thank you. So, I will go. Yeah, I just want you, of course, you know Einhard, but I want to say a few words about him. As you know, Einhard,
I don't know everybody, so I'm interested in this introduction because I know about half of the participants because I taught you, but many of you, and later at the time when I was already a retiree. And so
you will come back. Professor Emeritus Einhard Schmidt-Kallert has a track record of spatial planning experience, both in development, consultancy, and in the academic sphere. As consultant, he was the responsible project director of numerous feasibility studies and implementation projects in the fields of regional development planning, urban management, and natural resource management. He has worked in a number of African and Asian countries, but also in the transition countries of Eastern Europe and Central Asia. From 2005 to his retirement in 2014, he was the head of Department of Spatial Planning in Development Countries at TU Dortmund University in Germany. Over the last few years, he held teaching assignments at University of Duhok in Iraq, the Institute of Rural Development Planning in Dodoma, Tanzania, the University of Philippines in Manila, and University of Duisburg-Essen in Germany. For many years, he has advocated an approach to the study of urbanization and mega urbanization, which takes due account of a multifaceted linkage between city and countryside at all levels. He has published widely in scholarly journals and in magazines and newspapers, and has published and edited a number of books. Among others, for me, which also very important books that he published in 2016, unfortunately in German, called titled Magnetstadt, means Magnet City. For the one who know Germans, it's really interesting publication. It's about urbanization in Global South, but a comprehensive book on reason of rural-urban migration, housing, violence, the role of urban planning, and the role of strategy, government policies, NGOs, and the likes in urban development and toward the mentioned these issues. And also, I would like to say I'm especially glad that he's today with us and share his presentation. Hybrid sector synergizing the healthcare system with other sectors, the case of Germany. Please, Einhard, the floor is yours, and welcome.
We wanted the participants
before. Yeah. Okay, before we go to the presentation, I will give you the floor to introduce yourself shortly. It is important to tell us, some of you, I know you, but your name, when you studied spring, from which country you are, and the sector you are working, or the institute or university you are working currently. Thank you. Maybe I will just look from the perspective, Mohammeda, you start, and then follows Maximilian, then Ruth. I will give you the floor.
Hello, everyone, and thank you for being here. I am Mehmooda. I am the coordinator for this year's event, and very, very happy to be here with all of you. I am from Pakistan, and I graduated last year in Chile. Fortunately, I had the opportunity to be there because it was the last batch in English in Chile. So, and I'm working in the development sector for an all-women's development organization somewhere in a very, very remote area in the north. So for this conference, I've specially come to a big city so I can connect with all of you. So thank you, and thank you, Professor Genet and Professor Einhard. Lovely, lovely to see you. We've heard so much about you, and finally we had the opportunity to actually interact. Thank you.
I'm Genevieve, and as you can see, I had already somebody learning how to deal with future global pandemics. So I'm not here alone. I was in spring 2011 to 2013, and I graduated in Chile in 2013. In 2017, I came back to Germany. So currently I live in Germany with my family, and I work mainly on freelance with interesting change, but I work normally with small groups and workshops in anti-racism and women empowerment currently. That's what I do. And yeah, and I manage these little human beings. So I'm happy to see all of you here tonight. Yeah, thank you.
To avoid confusion, I will let you now. Max, please, could you introduce yourself?
Hello, everybody. It's really nice to see you all. I am Max. I am from Guatemala. I am from the batch 2016-2018, and I graduated in Tanzania. Right now, I'm working in the private sector in a consultancies company, and I'm mostly responsible for participatory processes in intermediate cities. We work both with land use plans and urban development projects.
Thank you. Ruth?
Hi, it's very late here in Manila. So I'm Ruth Equipaje, and I'm a graduate of spring 2003-2004, and then 2005 in the Philippines after Dortmund. And I've been visiting Professor Einhard and Anne and Weber from time to time in Dortmund. And I work now, well, I'm with Vincent Serrano at, he used to be my student actually in architecture. And we are now colleagues in the University of Santo Tomas. And I also have my own firm, and I'm also a consultant of the local government on sustainability. And currently I'm doing CLUPs also, comprehensive land use plan for cities, particularly those that are very much vulnerable to natural disasters. I'm very happy to meet all of you. I think I'm new here. I'm not from any program in Chile. Pleasant evening to everyone.
Thanks, Ruth. Boris?
Yes, can you hear me? Well, my name is Boris. A pleasure to be with you today. I study in spring from 2011 to 2013, graduated in Tanzania. I work as a planner for the planning office of the metropolitan area of San Salvador, the city capital. And well, it's been a rough time for us as well, dealing with all this pandemic and elaborating a lot of protocols. So it's really refreshing to be joining today these sessions and discussing all these ideas. And greetings to the Professor Einhard. I still remember that you beat us in the Dortmund Marathon. We were 25 by then.
So, thanks und benvenido. Agustin, welcome. You are muted.
Hello, everyone. My name is Agustin. I'm from Ghana. Currently, I'm in Chile. I'm also from the spring batch 2016 to 2018. Max was my classmate in Dortmund, and I graduated in Chile. Since then, I've been around here doing some consultancy and some research work. And last year, we kickstarted the spring conference series. Grace and I co-coordinated the first one that we had here in Valdivia. And we are so glad that this year around, when the pandemic struck, the alumni team led by Mahmouda has been working tirelessly to have this conference come on. And we are so glad that everyone is here to share ideas so that we can all look into the future and then build back our cities, as Mahmouda always says, big, bad, better. So you're all welcome, and we are glad to have you all. Thank you.
Aquava.
Meda was a P. Yeah, great. I don't see a name. There is somebody called city government. I don't see a face. Are you there, city government? Who is that? Do you know? Yeah, okay. Admir, Lelish, are you there?
Yes, I'm here. This is Admir speaking from Alumniportal Deutschland. I'm supporting here the event from the technical point of view. So, but I'm happy to be here and attending this session. Good luck.
Okay, thanks. Then Alumniportal Deutschland, it's also technical?
Yeah, they are handling the whole
Gladys?
for us.
Is Gladys there? No.
Yes. Hi. Everyone.
Hello, Gladys. Welcome. Welcome.
Welcome.
Nice to see you.
Thank you. I'm sorry we don't have electricity at the moment, but I'm just using this solar light. And thank you very much to the organizing team. And I'm so happy that I've managed to participate. Well, I graduated in the spring batch 2011 to 2013, and I graduated in Chile. And since then, I've been working from academia to development projects. So firstly, after spring, I was working with Great Zimbabwe University, where I was lecturing regional and urban planning. Then a year later, I was moved to local governance studies. Then a year later, that was in 2016, I moved to Nairobi. I was working with UN Habitat at the headquarters in Kenya. And I was responsible for project management. And I've been working mostly supporting the regional programs, and mainly in Africa and Asia region in water and sanitation sector, as well as urban development. Then I moved, the beginning this year, I'm now working with Green Climate Fund in Korea, but at the moment I'm still based in Zimbabwe. So I'm working on climate projects, and I'm managing the LAC region and the Caribbean, as well as Asia, Pacific and East Europe programs under the Green Climate Fund program called Preparedness program, where we are giving building capacity of different countries to engage with Green Climate Fund and other adaptation funds in climate. So thank you very much and welcome everybody, and congratulations to the organizing team. I'm so happy. Over.
Thanks, Gladys. Welcome also. Vincent Serrano, are you there?
Yes. Hi, everyone. Good evening from Manila. I am so sorry. I am so lucky right now that my internet was stable the whole time while I was doing the moderation, but right now it's so terrible. So I really have to make it quick. I am Vincent Serrano from Philippines, architect Ruth Equipaje here. Is a colleague in University of Santo Tomas. And I am very glad to be here tonight to listen again to the formidable Einhard Schmidt-Kallert. So yeah, thank you very much and looking forward to a fruitful discussion tonight.
Yeah, excellent. Good, thanks guys. Without any extra discussion, I will go to Einhard's presentation. Just give me a minute to control. You see the presentation?
Yes.
Yeah.
Yeah.
Okay.
Welcome. Go on.
I don't see the face. Okay.
You want to see more face?
No. It's all right. It's all right.
Okay, I'll go.
Okay. Yeah. My presentation is about the German case, the German response towards the COVID-19 pandemic. And I was asked by Mahmouda to talk about Germany. First, I was a bit puzzled because normally we don't talk so much about the German situation in spring. After all, spring was set up as a program focusing on the global south, on the countries of the global south. But I think this is, well, when we look at the SDGs for the first time are meant for the entire world, global objectives. So I think this is something which encompasses countries like Germany as well. Anyway, when talking about the global pandemic, about this pandemic, there's one thing which which has puzzled me for quite some time, which I think is a paradox. On the one hand, we live in the era of globalization, and we have always talked about globalization in the last few decades. Now we are faced with the global challenge, a global pandemic, which affects nearly every nation in the world. And when we look at the responses are national. Borders have been closed, and every nation tries to find its own course of action. Well, this is a paradox, but I think on the other hand, it is so important that this type of exchange, this changing of ideas, of experiences, is possible through the spring cross-regional dialogue. So I've always said, when referring to spring, spring is a global village. But initially, when I said that, we referred to the Spring Center in Dortmund, where all the different nationalities used to mingle. But now I think it has a different dimension, that we are meeting globally in different countries of the world to discuss the pandemic, the impact of the pandemic, responses, and try to learn from each other. Well, so I want to talk about how Germany was prepared for the pandemic. Then I will briefly take through these last 7 months from the German point of view. And then I will talk about some very important issues, any opportunities arising from the pandemic, the experience of the pandemic, and maybe scenarios for the future. Well, let me start with this first question. How was Germany prepared for dealing with the pandemic? So first of all, in terms of governance and institutions, you all know, because you have all been exposed to the German planning system, you know something about the German planning and the German governance system. So we have a federal system with responsibilities at all 3 tiers of government: federal level, state level, and local government level. And Germany has particularly strong and autonomous local government. So I think this is an asset. Then we have about 100% coverage of the population with health insurance, which of course is also an asset. Well, there was a national pandemic plan. This was elaborated by our Ministry of Health, I think a decade ago. Nobody knew about that in Germany. I didn't know about it before the pandemic, but this has been in the drawers for a long time. And in a way, the German government system was prepared for this kind of pandemic. Then regarding the healthcare system, I think the healthcare system in Germany is good. Before the outbreak of the pandemic, there was a lot of discussion whether we have excess capacities, whether we have too many hospital beds in Germany, we have to reduce the number of hospital beds. But now I think this is an asset in terms of resilience. We have enough hospital beds. We have, for example, we have 30,000 hospital beds in intensive care units, and 8,000 of these have been assigned to COVID-19 patients. Currently, about 1,000 are used. So we have good capacities. The last item, well, the preparedness of the population. This is, I think, a psychological thing. We Germans, the German population, or the people living in Germany, we are not really prepared for this type of disaster. We are not prepared. So we have experienced 75 years of peace. For instance, I'm 71 years old. I was born in 1949, 4 years after the Second World War. I've never experienced war or internal armed conflicts in our country. We have not experienced any major epidemic or any natural disaster different from the Philippines, for example, or many other countries in the world. So people were not really prepared for this type of epidemic. An interesting thing is, well, maybe some of you remember my demography classes. In the previous session, there was mention of my demography classes. Normally, at the beginning of my demography class, I used to show these diagrams of world population change over the years, over the centuries. And then we saw, when we looked at the growth of the world population, there are always dents in the curve. For instance, in the 14th century, well, that was the plague, because a big pandemic death toll. And then the wars, First World War, Second World War. But there was also another very important event, which was the Spanish flu, which ravaged not only Germany, not only continental Europe, but the entire world between 1918 and 1920. And the death toll was much higher than the death toll of the First World War. And yet, due to various reasons, there's very little collective memory of the Spanish flu in the population. For example, people remember, well, the great-grandfather was wounded in the First World War, things like that. But there's very little collective memory of the Spanish flu, the first pandemic which affected our part of the world between 1918 and 1920. Now, let me move to the next question. How has our country, how has Germany responded to the pandemic so far? How did Germany respond during the first wave and during the current second wave? Actually, what was the day one? Day one was the 27th of January. On the 27th of January, the first infection was of a COVID-19 patient was confirmed in Germany. Okay. Well, then you can see in this graph the peak of infections during the first wave in the month of March and the month of April. And then later on it went down. When you look at the international media, when you read international newspapers like the New York Times or El País or other international papers, Germany is very often depicted as well, success story, success of an early response, a swift response, and a successful response. Well, the reality is a bit more complex. So let's first look at the infections. So infection rate in March, but then there was also the response, government response started in March as well. So there were consultations between central government and the state governments. And in mid-March, all schools in Germany were closed, all kindergartens, all children's playgrounds, academic semesters of the universities were postponed. And a day later, all borders between Germany and her neighbor states were closed. And this was for the first time, you know, when you were in Germany, it was easy to travel between Germany and the neighboring countries. But for a period of 3 months, all borders with the neighboring countries remained closed. Well, then on the 22nd, a week later, 22nd of March, then all shops were closed down, all other commercial establishments were closed down, all shops except supermarkets and pharmacies. So it was a limited lockdown, not as strict as, for example, in France or in Spain, especially, but it was kind of a shutdown, which lasted for about a month. So the shops reopened in April, 20th of April. And then at the end of April, there was another decree, the mandatory use of masks in all public transport, in all means of public transport, in shops, in public buildings. Well, the schools were reopened before the summer holidays, depending on the state. So some at the end of May, others in June. Anyway, the result of the measures I've mentioned was really, as you can clearly see, a slowdown of the spread of the virus by June. Very few new infections by June. And this was why many people asked, especially outside Germany, why was Germany so successful in containing the virus? To some extent, it was the early response. The response started earlier than in many other countries. And then also coordinated activities, coordinated action by all 3 levels of government. So there were regular conferences between the Chancellor, Angela Merkel, and the prime ministers of the states. And the Chancellor gave press conferences. And when she gave her press conferences, she was normally flanked by the Minister of Health and the head of the National Health Institute, this RKI, National Health Institute, which also produces these statistics. So she was speaking as a politician, but at the same time as a scientist, a natural scientist. She is a physicist by background. And I think people felt confident. So there were opinion polls which said that about 70% of the population were supportive of the government's anti-corona measures. That was in June, July. And I think this was the time when outsiders, like, as I said, international media said, well, this is a miracle. Germany is a success story in terms of containing the virus. But scientists, virologists always said, well, be careful. The pandemic is not over. And there may be a second wave later on after the end of summer. And in fact, what you see here that well, there were not many new infections during the end of the summer holidays in August and early September, but then the rate was going up, and this diagram shows up to 7,500. That was 4 days ago. And then we had 3 days of even 10,000 infections, new infections per day. And the last figure, which I heard on the radio today, is 14,700. That is the latest figure, new infections in Germany. And Well, Germany has still not been as badly affected by the second wave as some other European countries, notably Spain, France, Slovakia, but there's the imminent danger of exponential growth. The health system is still fairly resistant. As I said, out of 8,500 beds in intensive care units, only 1,000 are occupied right now. So what we can see in this second diagram is the rate of confirmed deaths. So the death toll is still comparatively low up to the present day. And this is a diagram from the statistical office, which shows the death toll by COVID-19 as compared by the normal death rate for 2020 and the death rate for the previous 3 years. So we can say that there's been, in terms of excess deaths caused by COVID-19, it's not many. It's just a few, and right now we don't know yet because this doesn't show week 40 and beyond. But the virus has spread to many parts of the country. So we have when we look at the map of Germany, we see these dark red areas. Those are the districts with above 100 new cases in the last 7 days. And the other red areas show 50 new cases over the last 7 days. No. Okay, so what needs to be done in the short term? Well, the interesting thing is, as said, we have a strong autonomy at the local level. We have local public health departments, 400, but the 400 public health departments are no longer in a position to trace all new infections. So trace back where the people were infected. Only 50%, only for 50% of the cases, they're able to trace the origin of the infections. And this is due to, well, many problems of resources and maybe also the negative side of decentralization, that they are not used to coordinating their activities. They are in charge of a particular locality and not used to working across borders. But of course, we know that COVID-19, well, people meet other people, and then you have to coordinate with the different public health department, and they have different computer system, different software, and so on. Well, another thing is, as said, during the first wave of infections, people were more or less happy with government, happy with, so 70% of the people said they support the course of action taken by government. And now opinion polls show it's only 40%. And that's what you can also see in the media, that there's a lot more debate. Opposition parties have started questioning the government and say the role of parliament has been neglected during these last 7 months. There's all been by executive orders. There's need for more participation of the parliaments, and people are also saying there's more need for more participation of the population. So I think this open debate is good, it's healthy, needs to be encouraged. There needs to be more debate on the government course of action at all levels of government, within civil society, and in the media, in the social media. And lastly, what we need is, of course, responsible behavior by all people in the country. Well, when talking about COVID-19, normally we are talking about constraints, about because it is something new, and people are experiencing these restrictions. But as planners, we should ask the question, what are the opportunities arising for this period of crisis? And I think throughout this conference, we have heard about new opportunities. So that was the case yesterday in the opening session, and also in the previous session, there were some opportunities. As far as Germany is concerned, the little things, psychological things. Shortly after the lockdown, I took a walk with my wife in the forest near our city, near Essen, and we walked in a forest very close to Düsseldorf Airport. And this would not have been possible a month earlier, because in this forest, you are so close to the airport noise of aircrafts taking off, that it is no fun walking in the forest. So this was a window of opportunity, something we see a different world. Okay, this is maybe a bit different now, because air traffic has resumed, though not to the same extent. But people have learned that things can be different from as they used to be. Another thing is strengthening of neighborhood networks, especially during the lockdown. There were young people volunteering to do the shopping for elderly people who didn't want to go outside. Many people have rediscovered their own region as a holiday destination. So many Germans, most Germans, spent their holidays in Germany or even in their own region. The increased use of bicycles, this was mentioned yesterday as well in one of the opening statements. A spate of new bicycle lanes have been created, and then half of the population, half of the working population had to work from home. So this is also, well, I want to show that work from home is possible. I mean, maybe eventually people don't have to commute every day to the central business district. There will be less congestion, less need for office floor space. So these are some of the opportunities planners, we as planners, should identify and should be aware of. And of course, there are many others. I think you will when we do the brainstorming later on in the discussion, you will come up with many other ideas, identify other opportunities which have arisen in the course of the crisis. But in the last point, this is still open. This is what I'm hoping for as planners. Well, as a planner, I have always advocated that planners should be able to draw imaginative images of the future, scenarios of how a region, how a city should look in 20 years' time, could look in 20 years' time. To think of well, the unthinkable, what has not been, people have not thought about before. And I think we should convert these opportunities into positive scenarios, positive visions of the future. But I leave this to our discussion. Thank you very much for your attention, for listening.
Thank you, Einhard. You have to come up. Hello. Yeah. I think now it works. I'm back. Yeah, before I open the floor for your question, I want to call say something with respect to what you presented us, Einhard. Somehow I see kind of parallel, even though in different contexts, what Corona or this epidemic presents. Of course, it is undebatable, it's a negative situation, but it brought also something new, something positive. Even in most countries in Africa, I was following the news and some researches they were doing now. Even mortality rates decrease in these countries because the expected mortality from, especially from traffic accident, reduce drastically because of people don't move around so much, or I don't know, because of Corona, people pay more attention for health. I don't know how it is, but somehow the sum of mortality is less before the time of Corona. And that maybe it's one-sided, but I find it positive also. But the other things, coming back to Germany, I want to ask you, because you are saying that Germany is ready, Germany is prepared. And I'm recalling the discussion these last days on preparedness of Germany. People were saying or complaining that, of course, Germany has enough beds, enough room in intensive care, but not personals. And they say that they fear there will be still a problem if the trend, the current trend persists. That means the infection rate, if it continue and people who are needing assistance increase, that Germany also, the health system of Germany will also face a problem. What's your opinion with this respect? Just can speak.
Yeah. Well, I think Germany has been well prepared in terms of the health system, and also mentioned some of the other factors. But yeah, sorry. The German health system is fairly good, is fairly robust in terms of hardware. It's true, there may be bottlenecks in terms of mobilization of personnel, and this is being discussed right now. And this refers to many other sectors as well. But I think one big problem is, as I said, the mentality. And this is a psychological thing, that the Germans are not used to a situation of uncertainty. And this creates apprehension that people don't know what is going to happen next, because since the Second World War, they have been used to individually, they have been used to planning their future, being able to plan the future. And at the beginning of the pandemic, they were told this may last for a few months, and now they realize that this will take maybe 2 years until vaccine will be available and there will be vaccination for the entire population. But I think this is something we have to learn from the pandemic as well, that you cannot always plan ahead, and that there's also need for spontaneous solutions. And as I mentioned in the beginning of the pandemic, then there was so much empathy and solidarity within the neighborhood, something which was unexpected. And this does happen. It's possible to mobilize resources. So in this respect, well, I think what matters most at the moment is that the individuals still stick to the various rules which are very necessary to flatten the curve that the curve doesn't get develop into exponential growth. This is important, and this is something which needs to happen at the individual level. By talking about the psychology, at the moment, as I said, at the beginning, people were happy with government and with not only central government, also local government, and actions were well coordinated. And now everybody is talking about the different rules and regulations in the various states, in the various cities. Yes, that's true. It's not all that easy, but I think it's still possible for to safely maneuver through this crisis.
Thanks, Einhard. That is the challenge to work with two laptops.
Yeah.
Okay. I will please you can raise your hand and I will go accordingly for your question. Now going directly on the presentation of Professor Einhard Schmidt-Kallert. You don't have any question?
Yeah, I have one.
Ruth, please go on.
Okay, thanks, Professor, for the presentation. Very interesting.
Please, before we continue.
Yes.
Do you listen? Yeah, you hear me? Yeah?
Yes. Okay.
Do anybody, anyone of you mind? Sorry, I forgot to ask one of you to make a to make a note. Of course,
I'm taking notes.
You are taking note. Ah, that's great. Thanks. That's great. Okay, Ruth, you can go on, and then after Ruth, Boris, you can follow.
Yeah, please.
Question. Okay. Thanks.
Okay, me first. Okay. Professor Einhard, I'm very curious with you mentioned about that in Germany or the Germans, they have very few instances where they have to deal with personally to deal with coping with disasters or trauma, and this is such a great challenge for the local population now, how to cope. And you also said you mentioned about that Germans are used to being in control and really planning ahead everything, and now the whole uncertainty is doing a toll with probably with their individual. I'm very much curious about mental health of the people, how they are coping, and what is the government doing to aid the people also in this. Because in other countries, they're already, in our country, we have already some mental health issue. I'm teaching college students, and we do have some students who are undergoing mental health issues that they cannot, they need to take a leave from universities. And so I'm very curious, what is the German government doing to address this?
Yeah, there's no specific response in terms of the people's mental health. Of course, we have systems in place whereby people can consult the family doctor, and then they're referred to a psychiatrist. And this, but there's no evidence as yet whether there's an increased number of people needing this kind of assistance. I'm talking about the general public, not those who suffer from depression, but many people like you and me say, well, how is this possible? After 7 months, we still have to wear masks. And now they are talking about stricter measures, even in private homes, that people cannot receive guests from more than one household, things like that. This is not possible, and some people are filing lawsuits against government in this respect. And this has to do with this mentality that they, well, of course, they, after a while, everybody is getting a bit impatient. And this is the way it is expressed is also in many cases that there's more criticism of what the government is doing than at the beginning, and probably also then in some other countries.
Okay, thank you. The reason why I asked that is because you just said that the second wave is just peak this month, and I think there will be stricter measures because I'm following also the graph of our country. So we are also in our second wave, and then now a lot of monitoring is happening and tests. So now I cannot say it's still flattening, but then now we are now more also trying to reach out. That's correct, because we cannot rely on our government. We have to reach out, like me as an academician as well. We reach out to our students, and then we refer to proper psychologists. But I guess the others who in our country, health system is not free. It's not subsidized by the government. So we really have to do it. So we don't know what will happen. Hopefully we are not, it will not come to a point wherein the poor or the lowest income who are experiencing psychological problem because they're hungry, that they would, have some problem of security or having some violence involved. And that is something that we have to manage properly. And I guess a developed country like Germany will be, I think the best thing about that is that you won't have the problem of people being hungry, at least minimal, compared to the developing countries that we are really very scared that people will be so hungry, and then eventually they will resort to stealing or to be, violent. So I think that's something that, behavior-wise, we are very concerned with the psychology of all this pandemic. Thank you.
Yeah.
Ruth, coming back to Ruth question, because I'm seeing something that, because as outsider, what I notice is a difference, because a story you are telling us, it is similar situation if I take my country, Ethiopia. And here, that was the difference. Automatically, as the pandemic started, they had a capacity to react to it. Even for us, we have to change all our teaching to online, to Zoom, WebEx, whatever. The university was ready to buy automatically license to organize things that the teaching process continue as soon as possible online. One is that one, infrastructure. The other one is they have strong social system so far. And following the pandemic also, they were able to launch different programs to support people who lose their job, for students who fear to survive, because most students here finance themselves. They work in sectors which were closed and they weren't getting any income. But there were, most of them, they are living alone. They need to pay rent for their apartment. and they have to live every day. In that situation, this organized government system helped a lot. Maybe for the Germans, they don't see it automatically how strong it is in such situation. So in my opinion, what you say, this psychological pressure, it exists from different perspectives, but not that much so widespread, as most people automatically start getting support and at least not hunger, not even feeling like not paying rent for the apartment or not be able to go to use transport. So that is the difference, I think, the type of government and the resources they have as a rich country, I think. Maybe it's also respond to your question. Boris, you were asking? Maybe I ask Boris, maybe if he react, and I will come back to you. Is it something similar, or do you want to ask something different?
Something different. Maybe the professor can answer. Yeah.
Okay. Does anybody has with respect to this question? No. Then Einhard, please go on.
No. Oh, yeah. Okay. You can hear me now? Yeah. We don't have the same type of poverty in Germany, like many developing countries. That is true because of a fairly robust social system. And as I said, the health system is better developed even than the healthcare system in our neighboring countries. But of course, there are also losers in this situation. And this is especially in the field of education. So the schools were closed for 4, 6, 8 weeks. And then many teachers complained that they lost many of the students, even though the students and the teachers were supposed to introduce distance learning. But then the households which do not have any electronic equipment, and some of the teachers, in some cases, the teachers even visited their students personally. So they went to the houses and gave them assignments. But this differed a great deal. By and large, I think many of the school-going children from immigrant families, they suffered in this situation. And well, this is the type of social cleavages which has come to the fore in our country as well.
Thanks, Einhard. Boris?
Yes, thank you. So as we were seeing in the presentation, the spatial pattern of the virus in Germany, I couldn't help to notice that it's very similar as the one of other countries in the world, meaning the territories with higher densities concentrate the higher number of COVID cases. Like I can see in the map you were showing us, Munich, Frankfurt, Dortmund. So the most densely populated regions of Germany are also the one that with the higher COVID cases. My question is, do you think in the future this will turn into a change in the spatial configuration of cities or in the urban development, I don't know, like development patterns?
Yeah, first of all, well, it's true that many of the big cities have high rates of COVID-19 incidents, but there are other hotspots as well. So there are some hotspots in some rural districts, especially those with, for example, slaughterhouses. And there are a few other specific cases along the border. But and basically the most affected areas are Berlin and our entire region and so on. And well, I think this goes to show that our urban structure, our settlement structure, is not sustainable. And well, Germany has always been proud of an articulated hierarchy of central places. So apart from the big cities, we have many medium-sized towns. Unfortunately, over the last 20 years, these smaller towns and the medium-sized towns have lost out. So they've lost many of their commercial establishments, their shops, but also government institutions and so on. And this is really a pity because and this, I think, well, those places could have the potential to be to offer the best conditions for, well, best living conditions, shorter distances between work and residence, and so on and so forth. But I think what you're saying is completely true, that we need a reversal. We need a different kind of future scenarios. We need completely different settlement pattern with less concentration and with closer distances between the different functions, between the different urban functions, also urban gardening and proximity between recreational areas. Many of these things which have just been rediscovered by the Germans. So many people who used to fly to spend their holidays in, well, in Italy and Spain, in faraway places in Turkey and so on, they, for the first time in 20 years, they discovered their own country and spent their summer holidays in their own country, and they realized how beautiful this country is and what you can do in this country. Walking, cycling, all this has become much more popular than in many years. So this is encouraging. And as planners, of course, we have to pick up these experiences and translate them into positive scenarios.
Maybe we should come to it.
Yep.
Just for the sake of time, I have to interrupt him because we have.
No, that's all right.
Okay, thank you. We'll come back later. If you don't have further question, we should go first because we don't have much time, to the next part of our discussion to organize. First, we want to hear from you, also from your experience, what was, but really briefly, so that we can discuss on what to do in this, the different scenarios that we can, the opportunities and scenarios for the future. Could you explain for us what kind of response to COVID-19 in your country was taken as measure? What was the effective thing? What was the gap or the problem to react to this pandemic? To know the different experience. Maybe we start as we begins with on top in my screen. Mahmouda comes first, then Boris, then Ruth, then Maximilian, and then I will go on the rest. I will call. Thank you.
Shall I start? Thank you. Thank you, Dr. Einhard, for giving us such a great overview of what's been happening in Germany. Well, it was, and it is still very, very complicated here in Pakistan. I think initially we went with extreme soft measures, and I think the role of civil society was very, very important in these soft measures. So as Dr. Einhard mentioned, there were groups getting together that were really, getting out and trying to, for example, cater to the elderly people, or to get food together and distribute it in the low-income areas. I think the areas that were most hit were the low-income areas, because we also have a lot of secular conflicts around here. So if for example, a crisis happens, then there are tons of divisions that automatically come with them. So I think the people initially really stood up, and then later we are already going through a change in government. We're going through a change in systems, in organizations, and we were trying really hard in the past 10 years to also tackle poverty, and we'd come down to at least, I think, 3%. And in the past 6 months, it's gone up to 18% again. So yeah, the government is trying to, I think through digitalization, trying to develop systems side by side that are really working in. And yeah, I think the disaster management organizations are also coming up that are getting together. But of course, the numbers are flawed. So we really don't know if the cases are rising or not rising, or what's happening. So I think lots of politics involved. So, but slowly, government organizations, but the civil society has done, I think, really, really well in these times.
Thank you, Mahmouda. You mean there were more private or group reaction towards these problems than from the government, from state or governance level?
Yes, absolutely. And also, you know, how I think how the German system works, how it's so inclusive with the local government and the national government. We had a big disaster here because the national government said, okay, the provincial governments are in charge of handling each province. And then, for example, in one province, there was a lot of progress going on. In the other, there wasn't any, because the local scale, they didn't take any decisions. So of course, this gap is there, and it was more disastrous in this time than ever.
Thank you, Mahmouda. What was your experience, Boris? Or you are from El Salvador?
Yeah, from El Salvador, near Guatemala, I think, like Maximiliano.
Yeah.
Well, very similar to what Professor Schmidt-Kallert was telling us. The executive level started taking most of the decisions, and still is leading like the decision-making process. Congress, as you can guess, is not happy about this situation, to be excluded of the decision-making process. But so far it's working. I mean, we are in our region, meaning Guatemala, Costa Rica, Panama, the number of cases is controlled so far. We are not on the second wave. We are expecting to be, but so far the number of cases is still low. And from the planning perspective, it has been very interesting. We at least in our office, we have to deal at least with two different situations. First, in mobility, the public transport system in El Salvador is still very traditional, meaning not so good. So the bikers associations started to demand solutions, because you could no longer transport in the traditional buses, the traditional system, because it's not secure. So the bike was seen as a solution in our country. So now, because of the demands of this Bikers Association, we are working in a big bike lane master plan. And very interesting, the Congress, like 2 weeks ago, approved the first bike law to regulate how the bikes are going to be, the rights of all the bike users and so on. So I think without COVID, that will never happen in our country, you know, that they pass a law and the law was approved in a very short time. So that's like a positive outcome, I would say. And the other one is the tactical urbanism solutions. So in our country, yes, we have a lot of supermarkets, but I would say because of the prices, most of the population buys in public markets. But because of all these social distancing regulations, the public markets could no longer operate as they used to do. So again, all the representatives from the market sector started to demand from our office solutions. So we come up with a protocol for installation of, I'm translating this in my head, of street markets. So some, street markets, but a market that could be able to be installed with all these regulations due to COVID. And so far it's working, at least in the 14 municipalities of the metro region. This solution is working so far. And people is being able to buy their things, and they have to pass all these regulations established in our protocol, and it's very new. And the last one I would say is the use or the increased use of online platforms for entrepreneurs. There is a lot of unemployment in our country due to COVID.
Maybe we will come back again. It's
that will be
important point that you mentioned. Just to give a chance for the other one. Ruth, you are the next one. Huh?
Okay, I will be very quick. I already noted it down. So the first one, similar to Germany, walkability and cyclability became a very, very important aspect of mobility, because all public transportation were stopped. And then because of the absence of transportation, people cannot, and also with the situation of lockdown, there is a problem of even going to the stores and to the shops. So the first thing that were open are all food shops, because we need to feed the people. And the mayors from the national government, they gave a lot of power to the mayors, the local mayors, to do their own solution. So it was quite chaotic in the beginning, because there's really no single instruction. So the mayors were resilient enough to come up with innovative ideas. Like one of the mayors started mobile markets to bring markets closer to the smaller villages. And then there was also an offer like free transportation, but then it's not for all. A lot of the cyclist group encourage a lot of cycles. So the good thing is that when the restaurants closed, the bicycle shops went up. And this is very interesting. A lot of the people started to be so fond of planting or having, you know, taking care of plants, because we live in, some of us lives in condominium or smaller like studios and flats. And with the absence of proximity, there's a gap of proximity to parks. So they started to take care of plants. I myself took care of, like, my first time to take care of an indoor plant. And then tourism was badly hit because our country is really reliant on tourism. And that's the reason why we are now opening it up slowly with a lot of protocols, health protocols. And then agriculture, there was like a lot of crops still that were harvested, but the problem was distribution. So that's when a lot of the civic society helped by, they were the ones who picked it up from the farmers group and then bring it to the city or else. So I guess that, and then online education, I think all of us, we were open to online, but the thing is, the infrastructure, ICT, we have poor data still. So to sustain that, Zoom and all the online thing is, you know, the structure should be in place. Okay, thank you.
Yeah, thank you, Ruth. Max, what about you? Of course, Boris mentioned something in relation to Guatemala also, but what was different things, if there are, what was first the situation when the pandemic started, how the government, how the people reacted in your area, in your country, and what kind of responses were coming, different from what Boris already mentioned?
Of course. Yes, as Boris and you mentioned, many things were similar. For example, the bike lanes and the markets, the responses were similar. But when the pandemic started, we had lockdown really fast. When we had like 5 to 10 cases, we already had full lockdown where we could not go out for entire days. And I think it was good in the sense that it helped the government to have a little more time to prepare more hospitals. In Guatemala, there were like 4 or 5 hospitals which were built within that period. They were not equipped that fast, but somehow they helped to respond to the situation. Something else that the government tried to implement was to give economic help to the poorest families. So they created a program in which they would give within 3 payments money to the families. This amount was very small. It was not even 1/3 of the basic basket. And there was a big problem to make it work because the central government was giving the money, but they were distributing it through the local governments. But it was not possible because the money was meant to be for the informal sector. However, since they are informal, the local governments did not have a system, or they did not have a register of all the people to whom the money was intended. So actually the poorest people did not get the money at all. And so yeah, we are facing a lot of problems with that regarding the informal sector and all the people who lost their jobs. And then something else I also would like to mention is that in larger cities, we also had the issue, or it became evident that public spaces and green areas are so scarce because they are really, really far and people cannot access them. And the government cannot open them either because since they are so small, they fear that they will be crowded. So we think now that the places are reopening, for me, it was like really sad to know that malls were opening first because they are larger and there are more of them than parks because they were afraid that people will rush to them. And a couple of weeks ago, it was the first time that touristic places were open and parks. And exactly that's what happened. Like they were crowded. Probably not as bad as expected, but most people were heading there because after so many months of being inside the city, everybody needed to have contact with nature.
Thanks, Max. So Gladys, you are writing, it was a question for Einhard, but do you have something? Are you there?
Yeah, I mean, it
Yeah,
was
just
a
shortly
question for
also.
Einhard. Yes, yes, yes. Yeah, maybe from the experience of Zimbabwe, what I would say is it's actually difficult to respond to a pandemic if you are already in another crisis. So in Zimbabwe, we have been in a financial crisis which has lasted for over 2 decades. So already people are struggling. The government is struggling financially. So it was difficult from the government. So their first response was, even when we had few cases from day one, we had about 5 cases. But the immediate response of the government, in fear of what could happen when they are already not prepared, when they are already trying to, fight another crisis. So the first immediate response was a full lockdown, which limited people, like the movement of people. Really, it was so strict. They even deployed police and the army in the streets to control the movement of people. But what I learned from a planner's perspective is there is need to bring services to the people because of limited movement. Like for us, it was restricted to move from one neighborhood to the next. So you could not get out of your neighborhood. So from a planner's perspective is to ensure that you bring all the services to the people. And lucky enough in Zimbabwe, it is actually well planned that you have schools, you have hospitals, you have your local shops in this neighborhood. So you can easily go to the shops, you can easily go to the schools. But I mean, people have that choice that maybe their kids have to go to that other school. But I think from the pandemic, what the government has learned is to ensure that there's good quality of services that they are providing to the people, and to ensure that like promoting local, buying local, and to digitize, the economy or the services, really, because of limited movement. But really from the response of the government, I would say it was so political, like Momo is referred to, like it's so political in Zimbabwe at the moment. So the response was also very political, which didn't make any sense to respond to a pandemic. So yeah, thank you.
Thank you. Thank you. Augustine, are you there?
Sorry?
Yes, yes, I'm here. Yes, I'm here. Following.
Could you share with us? You are in Chile. You are in Chile. So
yeah.
Do you mind to share with us the experience in Chile? How was the situation when it starts the pandemic? How does it affect you? What is what you observed?
Yeah. So since I also have family and similar experiences from Ghana, I'm just going to make it short, like sharing 2 experiences. In the case of Ghana, just like many other countries, when the pandemic hit, first of all, we had a total lockdown of all our borders. And then the government started with some methodology that they call the 3 T's, like tracing, testing, and then treatment. So that one at the initial stages worked very well. And most of the cases that they identify at the earlier stages was mainly from foreign countries or foreigners, and then many of our earlier death rates were also foreigners. But then along the line, everything was relaxed because I don't know what happened, but I think the structure of our cities was also something to do with the lackadaisical attitude that were later introduced by the people. Because if you look at the dynamics, most of the young people live in the cities, like in Accra, in Kumasi, in Takoradi, and all that. And then those areas where the pandemic hit, those are the young people who were able to actually withstand the virus. So in those cities that have a lot of the viruses, we don't have a lot of death rates. But then in the rural hinterlands where you have the older people, where you have less of the virus or less of the infections rate, where those are the areas that we find some kind of how do we call it, increased death along those lines. But in most of the cases, they were foreigners who are working in some of the construction sectors or in the extractive sectors or things like that. So these ideas inform like the approach took by many Ghanaians, thinking that the virus is not as deadly as was initially suggested. So as we speak now, I don't think there are really many restrictions within the country, but then there are restrictions as to how you enter and then testing and all those things. But then there are increasingly some recorded cases, but then the recovery rate has been very high. And the last time that I checked, we're out of the over 50,000 infections that we have registered along the line, we have had less than around 100 deaths or so. No, around 300 deaths. And then as you see, we have around 400 or 500 active cases. And
but Agustin, just to bring you back, what was from the reaction of the government and from the people to control the pandemic or to react to it? What was the strong thing that you observed there? And it will be interesting if you compare it with Chile, because you live now in Chile.
Yeah, so in conclusion, so what they did initially, like I said, was when the virus struck, that was around 13th March, the government was also in panic, just like everywhere in the world. So they initiated the lockdown approaches where all our borders were locked down or were closed to traffic. And then they started with the tracing. So they came out with the 3 T's, like the tracing, testing, and treatment. So if someone is infected, they have to trace all the contacts, they will test them, and then those infected will be actually treated in isolation centers. And then we have about 2 weeks of lockdown, like total lockdown in Accra and then in Kumasi. And then right after that, all the restrictions as we speak has been eased. And then so now it's like when someone gets infected or when there's an identified case, then the government now puts in the methods to actually find out who is linked to this person or things like that. But then now what they are doing is those who enter the country and then those who leave. So before you can enter into Ghana now, you have to do a mandatory quarantine for 2 days, and then you also have to do a test at the airport. But as we speak now, there have been a lot of recoveries. So about around 90-something%, around 90, we have around less than 0.5% death rate or something like that, which is really negligible. So now things are really different in the country unless you want to enter. But in the case of Chile, I think it's a very complicated situation because here, one, they have an aged population. And then when the disease started or the pandemic started, at the initial stages, there was the safety that, okay, we would just allow people to get infected. And then when someone gets infected, that is where they start to follow the virus. So it was a different case. Here, you can't just go into the hospital that you want to do a test. You should be showing symptoms, which is really, a difficult situation, because if the person is already showing symptoms, it means that there are already a lot of people who have become in contact with that person. And I think that is the methodology that they are following here. So recently in where I live in Temuco, they were on phase 3. And then on phase 3 is when they allow restaurants and other service areas to open, but then with social distancing protocols. But then I think that was last week, we were brought back to phase 2, which means that when they go to phase 3 with the same kind of attitude and principles, the virus keeps spreading. So now phase 2 is all weekends strictly locked down. And then weekends and then holidays are locked down. And then from Monday to Friday, there's also a curfew after 10 p.m. So that is where we are now.
Just to understand what you said, that means in Chile, they try to late, because there was also in Sweden, in Europe, they let the infection go freely with the hope to see that people get resistant toward it. And now in the last moment, they start doing controlling in going back to lockdown, you mean? They change their strategy?
Yes.
No,
So
okay.
That is the approach. And then now the one other aspect is that in the initial stages, it looks like they were playing politics with the management of the pandemic, because the health ministry was doing a lot of calculations, which was really interesting, because when they even included dead people into the recovery rate and all those things, because so after all those things, when the whole mess came down, and then there were change in the management of the health sector and all those things, now they are trying to follow suit, like how it's been done in most of the countries.
Sorry to cut you, because the time, we don't have time even to go back. Is there, have I missed somebody who didn't?
We have no time.
Yeah.
I think I say a few words and then you summarize.
So if there is no one who really needs to say something, I will give Einhard the floor.
Yeah, there was one interesting question by Gladys. She asked the question, how can we planners get prepared for future pandemics, and what is our role? So this is, well, of course, a big discussion, and you can't capture this in just a few words. But I think this is a key question, which is which all of us need to answer, and especially younger people like yourselves who are working as planners. So Gladys also mentioned that the situation was very difficult in Zimbabwe, because apart from the COVID-19 pandemic, there was another crisis, the economic crisis. Globally, we are also faced with more than one crisis. Globally, right now we are faced with the pandemic, but of course, there's also the issue of climate change, and we have to do something about it. And when we think about our role as planners, so I think we as planners need to synthesize many of the good ideas emanating from those opportunities which were mentioned in your various country reports, which was very, very interesting. So these various reports and ideas and new opportunities coming up from the crisis. So we as planners need to synthesize those and think of better cities, more livable cities in future. And as I said, in the case of Germany, but in the case of many cities, we have to reorganize our entire settlement patterns. We need different types of towns, different setup of the relationship between workplaces and residential areas and so on and so forth. And this is the task ahead for us. In the wake of this COVID-19 pandemic, and also in the face of climate change and how to combat climate change. And on this note, I hand over to Genet again to wind up our session. Thank you very much from my side. I found it very interesting, very exciting to hear the various views and to get so many new ideas and insights about what is happening in terms of combating COVID-19 in different countries.
Thank you very much, Einhard. Just to conclude, it was a really interesting discussion. And as you see, at least from viewing what you discussed, there is some important things we learn. One thing, through this pandemic, we learn potentials that we didn't use maybe, or weren't so conscious. Like the example in Pakistan, what Mahmouda told us, this social organization who people actively try to help each other, to help the poor ones, the vulnerable one. That is important things. And as planner who are educated to bring always more participation, more involvement of individuals to take part in the decisions that affect their life. This is important thing to know and to be conscious also. There are a lot of resources community in the community level, which one should exploit. And then the other, from your discussion, it come out that there are a lot of opportunities in use of in our mobility pattern, mode of transportation, how we use space, how we become, how the role of ICT is become stronger in such kind of things, and show us the future strategy where should be. And in any case, the world is getting digitalized. But now we see that it's very important if we want to remain resilient to such kind of drastic risks that we might face in the future also. COVID itself also, it will live with us. It doesn't matter if there is, if they manage to develop or apply vaccination, it will remain the danger with us. And for that, always becoming more digitalized might be one of the opportunity to build on that. And then the third point that I took myself and I want you to take with you is from the discussion, to ask our way of life, to ask the question, to reflect what to change. This shows us what is possible in this situation, that we change it, how we live, how we use, how we move. And this is important thing because planning is future oriented. We plan towards the future. And if we are not ready for future, our profession won't make a sensible role in any kind of development. And this is important thing for us, that the future is uncertain. And as planner, we have to be able to get ready, not only for the problem we know now, but for this uncertainty. And that's what all I say. And please, I'll give the organizer the floor if they want to conclude something to say. Otherwise, on my part, I would say thank you very much for your participation.
Okay, Dr. Alem, thank you very much. And Prof. Schmidt-Kallert, it's nice to be in a class like this.
So I'm saying the organizers, if you want to say something.
Yeah, please, do you hear me?
Genevieve.
Please. Do you hear me? Hello, please, do you hear me?
Yes, yes, yes.
Okay. So, I've really enjoyed the session. Thank you, Dr. Alem and Professor Kallert. I remember the class in demography and population and demography, and we learned about the Spanish flu, and I never thought I'll live to see another pandemic again. So for me, it's interesting to relive it and know that we need to prepare. We never thought it will happen again, but I am seeing it now. And for once you sit and you have to think about all the things we never thought about were privileges, to ride a bicycle and now you can't, and all those things. So I believe I like the concluding part that we need to review our lives and know which are the important things and how to prepare for all the other things, what are important and what are not important. And for me, it's been very interesting. And before the lockdown, I was in Ghana before I returned, and for the first time, I realized that there is power in civil societies and each one of us, because communities became very active in helping out and all that. So I would encourage all of us that when the call for papers also come, let's speak our own local situations. You don't really need to be a prophet to write a paper, but I think in this situation, we need real life stories. And for me, for once in Ghana, we realized that there are people whose homes were the markets. So when we shut down, these people didn't have a home. And for me, those are the things we need to also think about, the new normal and the reality. So thank you, Professor Schmidt-Kallert and Dr. Alem. I hope we can do this more often, because it's like I'm reliving a spring classroom and it's interesting. So Mo, you'd want to take over and then remind us about tomorrow and all that is in stock for us. So thank you very much for the interesting contributions too.
Thank you, Genevieve. Dr. Genet, you would like to say something? No? Okay. Okay, great. Thank you, Dr. Genet. Thank you, Dr. Einhard. Amazing, amazing session. Had a great time. Just to remind you that tomorrow we are going to get together for a concluding dialogue at 5 p.m. German time. And it would be lovely to have you all there. Also, if we can all like give a thumbs up and a smile, Edmir, could you please take a screenshot or a photo so the session is live?
Yeah, please.
Okay, great.
Augustine, yes. Admit. Genevieve. Okay, 1, 2, 3, smile. Sorry, well, again, 1, 2, 3. Yeah, please, Professor. Again. 1, 2, 3. There you go. Thank you.
Okay, guys. Bye-bye.
Thank you so much. Thank you. Bye-bye.
Yeah. Thank you all, guys. Nice to see you.